As mentioned, there's some biological, psychological, and social aspects of developing an eating disorder. There's definitely a genetic component to eating disorders, and as well from a psychological perspective, things like a negative body image and low self-esteem can be impactful. Also from an environmental standpoint, social stresses and family conflict, as well as childhood trauma and sexual abuse are etiologic factors that we often see. There's a lot of medical complications from eating disorders. There's with a lot of other mental health disorders like anxiety and depression, you don't see a lot of medical complications, but for eating disorders we might see minor things like hair loss or constipation, which I don't think any of us want, but then more significantly, eating disorders can actually shrink your heart. When you're malnourished, your body eats itself for food. It's kind of gross, but it happens, and it eats your heart muscle and other parts of your body. So your heart actually shrinks, your heart becomes weaker. This can result in a slow heart rate, low blood pressure, dizziness, and low energy. You can also have electrolyte abnormalities, changes in your sodium and potassium. Your body's really reliant on this for things like how your heart conducts. So people can have sudden death if their electrolytes are not properly balanced. And eating disorders really adversely impact bone health. People can stop growing if they're malnourished, and also develop osteoporosis at an early age. I have quite a number of young patients in their 20s who have severe osteoporosis and multiple bone fractures from that. There's also medical complications from treatment of eating disorders. So when people start to eat more consistently and stop using their behaviors as much, people can have pancreatitis symptoms and also develop something called refeeding syndrome, where they start to retain fluids and can actually go into heart failure and die. So those are important medical things to consider when treating eating disorders. As far as therapy, it is pretty complicated. Yeah, I think as was mentioned with addictions, with a cocaine problem, you can stop using cocaine and avoid places where you might encounter it. That's oversimplified. There's a lot more involved in treatment. But with food, you can't avoid it. It's there all the time. You need to eat it many times a day. So we really focus on consistent normalized eating and trying to reduce the frequency and severity of these eating disorder behaviors with various individual therapy techniques, psychodynamic, cognitive behavioral, and dialectical behavioral therapies. We also do a lot of family therapy. At the very least, families need education about eating disorders. They're tough to understand. And we also focus on family struggles or conflicts that might perpetuate an eating disorder. And then there's a lot of what we call comorbidities with eating disorders. People who have eating disorders often suffer from depression, anxiety, addiction, trauma, post-traumatic stress disorder, and borderline personality disorder. And so as their eating disorder behaviors get better, oftentimes we see other things get worse. Their mood, their anxiety, substance abuse, self-harm, cutting, those things may also all get worse as their eating disorder is actually getting better.